The scapula is one of the bones of the shoulder girdle. The scapula and the clavicle make up the shoulder girdle. And to view it a little bit better, we're going to look at it from the back side. So the scapula has kind of a triangle shape overall. It has kind of a triangle shape. And it has three borders, which are like the sides of the triangle, and three angles, which are the points of the triangle. The borders are the vertebral border, which is next to the vertebra, the axillary or lateral border. So axillary is like the armpit, or you can call it the lateral border since it's on the lateral side, and then the superior border. And the angles are the inferior angle on the inferior part of the scapula, the superior angle, and the lateral angle. The lateral angle is where we find the glenoid fossa. This raised ridge right here, this I've kind of colored over in green, this is the spine of the scapula. And it separates two fossae. So if we remember, a fossa is like a shallow kind of bowl. So the spine of the scapula separates the infraspinous fossa from the supraspinous fossa, which makes sense because the infraspinous fossa is inferior to the spine and the supraspinous fossa is superior to the spine. Then moving to a more anterior view, I'm going to go ahead and get rid of this humerus. Here you can see the acromion process right up here. And the acromion process articulates with the clavicle right here to form the acromioclavicular joint. The acromioclavicular joint is a fairly common place for injury for people that do a lot of like powerlifting or Olympic weightlifting or a lot of really heavy bench press, because that puts a lot of stress on this joint right here, and that can sometimes get loose or tear. The coracoid process is this other process, this other part that sticks out right here. This is the coracoid process. And it serves as an attachment point for some muscles, including the pectoralis minor muscle, which is related to pectoralis minor syndrome, which we will talk about in a later chapter. And then, of course, we have the glenoid fossa right here. And the glenoid fossa is the socket part of the shoulder joint. The shoulder is a ball and socket joint, so the head of the humerus is the ball, and then the glenoid fossa is the socket in that ball and socket joint. And then we have one more fossa. We have the subscapular fossa, which is on the back side over here, or really the anterior side. And if we move some of the ribs away, we can see it a little better. But this is the subscapular fossa, is this whole region in here. It's just one big old fossa. And there's a bunch of muscles. There's several muscles that are kind of sandwiched between the subscapular fossa and the rib cage. Fossa. So remember, the scapula does not directly articulate with the ribs. It has some layers of muscle and connective tissue in there that allow it to have a good amount of mobility, and it can kind of glide over the rib cage.